There has been a surge in COVID-19 infections in Rwanda, and while at least 2 prison facilities have recorded about 40 cases in 2 days. On Wednesday, November 11, 7 people tested positive COVID-19 in Nyarugenge Prison, whilst 13 more inmates from Rwamagana Prison, commonly known as Nsinda, tested positive for COVID-19 on Monday. That was November 9th. 4 of them have succumbed to the virus, according to the Ministry of Health. In a phone interview, the Commissioner-General of Rwanda Correctional Services, George Rwigamba, explains the precautionary measures that have been put in place to contain the spread of the virus among prison communities, and gives us the current situation in prisons.
Yeah, the situation is that in the 2 prison facilities, that is Rwamagana and Nyarugenge,
yes.
It was identified that we have got some cases, some cases of COVID-19, and the medical teams from RBC and the Minister of Health have swung into action, and they are trying to control the situation, and the cases that were identified are being attended to.
Yes.
They have been put in isolation, and they are they are under treatment. And so the measures are as usual, but there is no saturation from outside the facilities that are coming in, and there are no saturation from the facilities that are going out. While we are having other services being given online, like the courts are continuing, but the court services are being taken online. Those who are in prison are attending the courts
online. Also, if you could give us the situation in terms of the numbers of infections currently, how many are they?
The numbers we are having 16 in Rwamagana yesterday, and about 20 in Nyarugenge Prison. How
many are in critical condition?
In critical condition, I can't be able to tell you now. The medical services are the ones who have got all the numbers, and those who are being attended to in critical condition. That is RBC and Nsinda, they can tell you.
What has been the cause of the surge in new infections? Yet we know the visitors are not allowed to visit inmates currently.
The cause I cannot be able to tell you now, because I don't know the. I don't know how it came in.
Yes.
With the test, we first saw the cases coming. We reported them to those medical teams of RBC, and the RBC went to test, and the tests were carried out to everybody. The prisoners and the prison staff were tested. This when we identified those cases. So I don't know. I cannot know the cause. I don't know the source of or the carrier who carried them into the prison facilities now.
As we conclude, what else should we know about this situation, the development?
The development is that those who are identified are being taken care of, and the measures are becoming a bit more strict, and to those who are coming in and those coming out.
Yes.
To better control the spread of the COVID-19 in the prisons.
The Commissioner-General of Rwanda Correctional Services, CPG, George Rwigamba, explaining the current situation in prison facilities following the surge in new COVID-19 infections.